There is an abundance of research regarding how common it is for students to experience lateral violence during professional practice. In one study, a shocking 52% of students reported that they expected to be bullied when out at placements. This mistreatment of students may be in the form of verbal abuse, physical violence, bullying, ostracism, disrespect, and put-downs. Other examples are when students are delegated the menial tasks, not allowed to perform certain skills, not invited to participate in staff meetings, and made to feel powerless. There are a number of terms used in the literature to describe the mistreatment of students. However, for the purposes of this learning module, the term lateral violence will be utilized. Griffin, 2004, defines lateral violence as professionals covertly or overtly directing their dissatisfaction inward toward each other, toward themselves, and toward those less powerful than themselves. This type of workplace violence results in serious emotional and psychological harm, as well as making students leave the profession. Students often feel invisible and choose to say nothing for fear of retribution.
Hi, Amy. Thanks for coming in today to share your story.
I have a few stories to share. The one that sticks out in my mind the most was from my first real placement. My student group and I were all assigned to our first hospital placement. We had never been there before, but were told by our instructor to arrive early to read our patients' charts. We all agreed to go up to the floor at 6:15 a.m. to research our patients together. Our shift was to begin at 7 a.m. When we arrived, we introduced ourselves to the health professionals that were at the main desk. The one woman's first response was, "Oh no, we have students today." She then ushered us over into a corner to look over some of the charts and told us to stay out of the way as this is going to be a busy morning. After a couple of minutes, she called out, "Which one of you is assigned to Mr. Rawlings?" That was me. So I told her, "I am." She then motioned for me to come over and said, "Mr. Rawlings has gone to X-ray, but needs his bed changed, so you can go in and do that before he returns." I began to explain that it was my first day and that I wasn't sure what I was to be doing and maybe should wait for my instructor. She replied, "Forget it then. I don't know why we bother with students. None of you can do anything." I felt so belittled. I spoke to my instructor about it, and she said I did the right thing by not going to make the bed, as it was just my first day. But I still felt like, what would it have hurt if I went and changed a bed? Maybe if I did, she would have liked me.
Why do you think she didn't like you?
Well, a few weeks later, I had another situation with the same nurse. In our lab at school, we had just learned how to take vital signs, so I was excited to get to practice on real people. I went to get the electronic blood pressure cuff and realized it wasn't the same one that we had learned on in school. I was a bit perplexed, and so rather than take my patient's blood pressure incorrectly, I thought I better get help. I went looking for my instructor, but she was with another student. I thought I would wait, but then the same nurse from my first day came into my patient's room, looking for the electronic blood pressure cuff. She asked if I was done with it, and I replied, "Well, honestly, I haven't used it yet as I'm not sure how this particular one works." She said to me, right in front of my patient, "Clearly you don't know what you are doing." I felt so incompetent. Worst of all I could think about was what was my patient thinking as she said this right in front of him. I explained to my patient later that I had learned how to take a blood pressure, but just wasn't sure about this particular piece of equipment. I managed to get through the day and that placement, but I avoided that nurse as much as possible, and I dreaded going to placement every week on that floor. I thought about it later and realized she didn't even know my name, nor did she even care. But I sure knew her name, and I would pray every week that she wasn't the nurse assigned to my patients.
Did you talk to your instructor about the situation?
Yes, I told her, and she was really supportive and suggested we talk about this with the group after clinical. When we did, another student shared that she knew how I felt because she had a similar but worse experience. She was assigned to a medical floor, and when she arrived, she saw her patient from the week before sitting in a wheelchair, slumped over by the nurse's station. She went up to the patient and bent down to say hello and see how she was doing, and the patient startled and lashed out and hit her. The health professional standing nearby said, "Serves you right, you should have asked me first before going up to her like that."
How did you feel when you heard that story?
I guess we were all kind of surprised and shocked that she got hit, but we were more shocked by what the health professional said. We thought that healthcare professionals are caring people. It made me wonder, weren't they all a student once? I know we ask a lot of questions, and they are busy, and we take up time, but how else are we going to learn? I vowed to myself that never, ever will I treat a student poorly, and will always make them feel welcome and a part of the team, no matter how busy or stressed I am.
Thanks for coming in today, Amy, to share your story.
Thank you.
During professional practice, students anticipate that they will be a respected member of the interprofessional team and so experience shock when they are treated poorly. One recommendation to begin to address the issue of lateral violence in healthcare is to educate healthcare professionals regarding the prevalence and damaging effects of lateral violence, and for organizations to become a workplace free of violence, where professionals feel empowered. Students require ongoing support to break the cycle of violence in the workplace. Prior to professional practice, students need to feel prepared for these potential negative encounters and need to possess assertiveness and conflict management skills. All too often, students do not report the lateral violence as they reside within a climate of fear versus assertively responding to the individual or reporting the incident. In this next session, assertive communication skills will be reviewed as a means to provide students with the tools necessary to address the violence. Students who are able to assertively address a situation and who have support from a preceptor or clinical instructor feel less stressed and more confident. As well, students who learn to identify situations early seek guidance by talking to a confidant, preceptor, student colleague, faculty, are more able to manage the situations. Students and preceptors need support from leadership and organizations that endorse a culture that supports collaboration and empowerment of health professionals.